read the stem, and here is your stem. Right. So if you've read and understood, considering it critical care scenario, please tell me how would you manage this patient now?
Okay. So I will manage the patient according to the critically ill surgical care patient.
Yes.
So I will go through the ABCDE protocol. So I will talk
Yes.
to the patient. Is he able to talk or not? If he able to talk, that means the airway is patent. Then I have
Yes.
to look for breathing. How is the breathing rate? Of course, it will be like having some difficulty in breathing. We have to check chest expansion. We can check saturation. How is the SpO2? Then we can put him on oxygen,
Yes.
either via non-breathable face mask or a nasal prong. Then we'll go for circulation. We can open two wide bore IV cannula and start with the crystalloid fluid 1 liter.
Right.
Then
And after you've read the stem, kindly please tell me what are the provisional and differential diagnosis you'll consider.
my provisional diagnosis will be peritonitis secondary to anastomotic leak,
Good.
and the differentials could be due to the atelectasis or maybe pulmonary embolism.
Right. Okay. Please tell me how would you interpret the arterial blood gas that you're reading right
So
now in front of you?
the pH is showing 7.2. That means it's acidosis,
Yes.
and bicarbonate is low, so it could be due to metabolic acidosis. And
Right.
PC is 32, so that looks like it's trying to compensate, but is not compensated yet. So you can say it's
How,
partially.
yes, how would you take care of patient's arterial blood gas?
Mm. Okay, so we have to look for the other electrolytes. How is the potassium? And we have to start with IV fluid, and then we can give broad spectrum antibiotic. And if there is an electrolyte imbalance, we have to take care of that one. So hopefully it will improve.
Okay. How would you take care of patient's hyperkalemia?
So if the patient is hyperkalemic, we can start with 10 millimole of calcium gluconate IV. Then we can give uh, 10 unit of actrafen in 200 ml of 10% dextrose. Then we can give salbutamol inhalation, and then we can give maybe sodium bicarbonate.
Yes, at the same time you'll be doing what monitoring would you be carrying
We
out?
have to monitor the patient's cardiac activity. We
Very
have
good.
to put on ECG monitoring. Then we can do blood pressure, pulse, urine output,
Vitals.
and the
Okay.
mental status. Yes.
Right. Considering your provisional diagnosis, kindly tell me which organisms can lead to the inflammation or the infection. What are the
So,
common organisms that one can come across?
okay, so it could be a Staphylococcus aureus, Streptococcus, then maybe bacteroids, Klebsiella.
They say it's because it's anterior section. So the most common is Staph epidermidis. So
Okay.
can you suggest how can one prevent the spread of the infection? What measures can be taken?
Okay, so from the theater, we have to drape and prep the patient properly.
Yes.
Then we can try to be like less exposure of the patient. Then try to be as fast as the procedure, I mean the short procedure. Then afterwards, we have to take care of the wounds, daily dressing, then early mobilization.
Okay,
And in theater, maybe we
after
can
theater, patient has moved to, yes,
move to post-op. So
yes,
theater, we can do what do we call that one? Laminar flow.
yes, more if you can think of, because here patient post-operatively has many, central line is there, urinary
Yes.
catheter is there, so
So
many lines are there. The sooner you can take those out, the
yeah, as
less
soon as
chances of,
possible, we have to remove maybe the catheter and early mobilization. Then we can
yes.
remove the drain, and of course,
Please tell me what might cause or what might be the cause of deep vein thrombosis or the pulmonary embolism that you thought could,
okay, ma'am. So due to this major operation, of course,
yes,
is a major operation. Then
yes,
prolonged operation. Then not early mobilization. I mean,
yes,
if the patient is bedridden, then malignancy could be another
yes,
cause.
yes. Okay. And what precautions can be taken?
So precaution we can take early mobilization of the patient, and then we can elevate the lower limb. We can use pneumatic compression
Yes,
stockings.
yes. And if you suspect that patient could have pulmonary embolism or deep vein thrombosis or something, you
We
can even
can
suggest.
start, yeah, we can start prophylactic low molecular weight heparin.
Right. Okay. How would you take care of the nutritional status of the patient? You'll be giving intravenous fluids, but how would you calculate how much would be the maintenance and the regular dose that you'll be giving to the patient?
So maintenance, maintenance, I don't know, ma'am. Initial, I think we can give a 20 ml per kg body weight.
Okay.
So maintenance, how
Initial.
much we have to
Afterwards.
give? Uh, maybe 2.5 liter for 24 hours. So I don't know like how to calculate.
Okay, considering the patient could even go because patient is having a fever and tachycardia, how would you assess the level of shock patient is going through?
Okay, so we have to go through quick SOFA score,
Yes,
sequential organ failure assessment. We have to start with the uh, sepsis 3. Okay, so far we have to score like mental status, hypotension, and tachycardia. So 1 point have for each. So if it's 2 or more, then we have to suspect the patient is having a septic shock.
yes,
Then we can manage the patient according to the sepsis 6 protocol. We have to start IV fluid, oxygen, then intravenous antibiotic according to the local protocol, and talk to the microbiologist.
yes,
Then we can take blood for culture, and then we can take ABG, lactate,
yes. How
and
frequently do you
CRP
think this patient needs monitoring?
every hourly.
Okay. And where do you think this patient should be managed?
Uh, at least SDO.
Okay. What is the criteria for managing a patient in HDO?
At least one organ failure if the patient need continuous monitoring. If the patient
Yes,
having maybe need respiratory support.
yes. And one-to-one
One to
nursing.
one. Okay.
Good, good. Thank you.